in children shows up a lot different than it does in adults. Typically, anxiety in children is going to live a lot in the body. So you're going to see a lot of stomach aches. You're going to see a lot of decreased appetite because maybe they're not hungry, again, with that stomach ache. You'll also see a lot of irritability or possibly even aggression or impulsiveness or difficulty focusing, which again, if you think about anxiety in adult, which might be more excessive worry or guilt, difficulty controlling the worry, or an uncontrollable thought that something bad might happen. Not to say that a child wouldn't experience those, but they're less likely to experience those than they are the physical symptoms. One of the classic things that you look for as a parent, of course, is a kid that talks about having a lot of stomach aches, or a kid that wakes up in the morning and they don't want to go to school. It's not usually because they're trying to be bad or they're trying to be defiant. There's something going on at school that is just kind of stressing them out. School is really, really stressful for kids. Of course, you have testing, which is probably a whole nother topic that could be talked about. But there's a lot of social stress that happens at school, particularly since we're making that transition from COVID, where everybody was very, very isolated. A lot of learning took place online, which is not conducive to a lot of children, especially young children. They really need physical interaction. They need that body learning in order to truly understand something. And so a lot of them didn't get that, and they're falling a little bit behind. And so some of the things I hear from teachers is there's a lot more fidgeting, there's a lot more difficulty focusing and things like that. As a parent, I think some of the things that you can do to help is to always normalize. That's one of the biggest things. We don't want to stigmatize ourselves or our children when they're experiencing something. We always want to tell them that it's okay. People feel like that, and it's okay. It's normal to feel like that. It's also normal to ask for help so that you can feel better, which is always the end goal. Doing some breathing exercises for anxiety is always really helpful with children, and they like it if you can kind of make a game out of it, and if you do it with them. Modeling that behavior, modeling those breathing or meditation techniques really helps. Physical activity, spending a lot of time with them, whether that's something simple like going for a walk around the block after dinner or right after school, can be really helpful as well. Kind of giving them that mental and physical break as a transition from school to home life. Northwest Texas Behavioral Health does offer child and adolescent services. We have inpatient services, and we also have outpatient services through our partial hospitalization or our intensive outpatient program. That is primarily group therapy based, and there's also a psychiatric medication component to the treatment there. Children and adolescents will be in groups with children approximately their own age, and they do a lot of work on emotional expression, how to name emotions, how to deal with emotions, and how to communicate what their needs are in order to improve their functioning at school and relationships with their family and their performance and success at school.